We've discussed heat illness. At the other end of the spectrum is cold illness. Lucky for those of us living in South Texas, having to deal with cold illnesses isn't something that happens very often. But in other parts of the country and the world, this is a hard issue to deal with. The two most common cold illnesses are hypothermia and frostbite. Hypothermia is a decrease in the body temperature, occurring when the body is unable to maintain a constant core temperature. Hypothermia occurs when your body loses heat faster than it produces it. The most common cause of hypothermia are exposure to cold weather conditions or cold water. But prolonged exposure to any environment colder than your body can lead to hypothermia if you are not dressed appropriately or cannot control the conditions. Some specific conditions leading to hypothermia include wearing clothes that are not warm enough for weather conditions, staying out in the cold too long, you're unable to get out of wet clothes or move to a warm, dry location, accidental falls in the water, as in a boating accident, or falling through the ice on a lake or a river, inadequate heating in the home, especially for older individuals and infants, and air conditioning that is too cold, especially for older individuals and infants. Normal body temperature is around 98.6 degrees Fahrenheit or 37 degrees Celsius. Hypothermia occurs as your body temperature passes below 95 degrees Fahrenheit or 35 degrees Celsius. When your body temperature drops, your heart, nervous system, and other organs cannot work normally. Left untreated, hypothermia can eventually lead to complete failure of your heart and respiratory system, and eventually can lead to death. Hypothermia is most often caused by exposure to cold weather or immersion in a cold body of water. Primary treatments for hypothermia are methods to warm the body back to a normal temperature. With cold weather or exposure to the cold, there is a vasoconstriction of the fibers of the surface of the blood vessels. This prevents blood from going to the skin and attempts to maintain a core body temperature. This shunting of blood from the shell to the core is done to maintain our vascular volume. This is known as cold diuresis. Another reason for shunting the blood towards the core is to maintain the body's organs and the brain. Cold weather also stimulates the release of certain chemicals that increase metabolic activity and heat production. If vasoconstriction and increasing metabolic activity do not work, shivering begins to produce heat through involuntary muscle contractions. When the core temperature falls below 94 degrees Fahrenheit, essential biochemical processes begin to slow. Heart and respiration slow down. Cardiac output and blood pressure fall. As the skin and muscles cool, shivering increases. If the temperature continues to drop below 90 degrees Fahrenheit, shivering ceases and muscles become cold and stiff. Here's an image about how our body addresses cold. We can see the cold setting in, then amnesia, cardiac arrhythmia, muscle contractions, pre-coma stages, a coma, pallid skin, loss of muscle tone, slower heartbeat, indiscernible breathing, and eventually death. Hypothermia, the signs and symptoms. Shivering is likely the first thing that you'll notice as the temperature starts to drop because it's your body's automatic defense against cold temperature. It's an attempt to warm itself. In mild hypothermia, signs and symptoms include shivering, dizziness, hunger, nausea, faster breathing, trouble speaking, slight confusion, lack of coordination, fatigue, increased heart rate, uncontrolled breathing, mental confusion, loss of coordination, cold and blue skin, irregular heartbeat, weak pulse, and enlarged pupils. As your body temperature drops, the signs and symptoms of moderate to severe hypothermia include shivering, although hypothermia worsens, shivering stops, clumsiness or a lack of coordination, slurred speech or mumbling, Confusion or poor decision making, such as trying to remove warm clothes. Drowsiness or very low energy levels. Lack of concern about one's condition. A progressive loss of consciousness. Weak, slow pulse. And slow, shallow breathing. Someone with hypothermia usually is not aware of their condition because the symptoms often begin gradually. Also, the confused thinking associated with hypothermia prevents self awareness. The confused thinking can also lead to risk taking behavior. Hypothermia in infants. Typical signs of hypothermia in an infant may include bright red or cold skin, very low energy, and a weak cry. Hypothermia is not necessarily related just to the outdoors. Hypothermia is not always the result of exposure to extremely cold outdoor temperatures. An older person may develop mild hypothermia after prolonged exposure to indoor temperatures that would generally be fine for a younger or healthier adult. This can occur in a poorly heated home or in an air conditioned home. Signs and symptoms of this type of hypothermia may not be as obvious. The treatment for mild hypothermia should include maintaining basic life support, activation of EMS or emergency medical services, moving the victim to a warmer area, removing any wet clothing and replacing with dry clothing, and if the victim is conscious, warm fluids may be given. Frostbite is caused by the freezing of soft tissues. There are three main types: chilblains, superficial frostbite, and deep frostbite. The severity and damage depend upon the depth and penetration of cold, resulting from the duration, the temperature, and the wind velocity. The most common areas that are affected are the fingertips, toes, earlobes, and the tip of the nose. The skin initially appears red and swollen, and then the individual will typically complain of an itchy sensation followed by numbness. The area then will turn white with a yellow or blue tint that looks waxy. Deep frostbite is completely numb to the person. Chilblains are the result of prolonged and constant exposure to cold for many hours. This may indicate a problem in the peripheral circulation. The signs and symptoms include redness, tingling, pain in the toes or fingers. The treatment is to prevent further cold exposure. This is a picture of chilblains. Here's another picture of chilblains in the toes. Superficial frostbite involves the skin and underlying tissues. The signs and symptoms: the area feels firm to the touch, but the tissues beneath are soft. The treatment includes taking the individual indoors and protecting the individual from further refreezing. Remove any clothing, jewelry, or rings, and immerse the area in heated water. The temperature for the water should be between 104 degrees Fahrenheit and 108 degrees Fahrenheit for 30 to 35 minutes. Avoid extremely hot water, as this may burn the person. Remember, with frostbite, the individual cannot always tell sensation, so it's possible that the individual may not be able to tell if the water is too hot and is actually burning the tissues. Here's an image of how we treat superficial frostbite. We soak the injured area until it flushes pink. Keep the water fresh and warm, and keep the injured area away from the sides or the bottom of the tub. Deep frostbite involves the deep tissues of the skin and subcutaneous layer, and it may result in the destruction of the injured tissue. Signs and symptoms: the skin feels hard because it's frozen tissue. As the area thaws, it will feel numb and may appear blue or purple. Capillary damage may leak into surrounding tissues, causing swelling. Here's a graphic with different levels of frostbite, from frost nip, superficial frostbite, and deep frostbite. We can see by this image different tissue layers are involved. The treatment for deep frostbite includes first aid care and medical treatment, depending upon the severity of the frostbite. You can treat very mild frostbite or frost nip with first aid measures. All other frostbite requires medical attention. Do not rewarm frostbitten skin with direct heat, such as a stove, heat lamp, fireplace, or a heating pad. These can all cause burns. If there is any chance that the affected areas will freeze again, do not thaw them. If they are already thawed, wrap them up so that they do not refreeze again. Give the individual some pain medication. If the individual is in pain, have them take some over the counter ibuprofen, Advil, Motrin IB, or others to reduce pain and inflammation. Do not walk on frostbitten feet or toes if possible. This further damages the tissue. For the treatment, when the part is rewarmed, dry the area and apply a sterile dressing. Cover the entire area with towels or blankets and transport to the nearest emergency center. Transport with the limbs slightly elevated if possible. Be aware that blisters may develop beneath the outer layers of the skin, and gangrene may develop within 2 to 3 weeks. Throbbing, aching, and burning sensations may last for weeks. Skin may remain permanently red, tender, and extremely sensitive to the cold. Frostbite can be prevented. Here are some tips that can help you stay safe and warm. Limit the time you're outdoors in cold, wet, and windy weather. Pay attention to weather forecasts and wind chill readings. In very cold, windy weather, exposed skin can develop frostbite in a matter of minutes. Dress in several layers of loose, warm clothing. Air trapped between the layers of clothing acts to insulate against the cold. Wear windproof or waterproof outer garments to protect against the wind, snow, and rain. Choose undergarments that wick moisture away from your skin. And change out of wet clothing, particularly gloves, hats, and socks as soon as possible. Wear a hat or headband that fully covers your ears. Heavy woolen or windproof material make the best headwear for cold protection. Wear mittens rather than gloves. Mittens provide better protection, or try a thin pair of glove liners made of a wicking material, like propylene, under a pair of heavier gloves or mittens. Wear socks and sock liners that fit well, wick moisture, and provide insulation. You might also try hand and foot warmers. Be sure that the foot warmers do not make your boots too tight, as this can potentially restrict blood flow. Watch for signs of frostbite. Early signs of frostbite include red or pale skin, prickling feeling, and numbness. Plan to protect yourself. When traveling in cold weather, carry emergency supplies and warm clothing in case you become stranded. If you'll be in remote territory, tell others your route and your expected return date. Do not drink alcohol if you plan to be outdoors in cold weather. Alcoholic beverages cause your body to lose heat faster. Eat well-balanced meals and stay hydrated. Doing this even before you go out in the cold will help you stay warm. And if you do become cold, drink warm, sweet beverages such as hot chocolate. They will help you stay warm. Keep moving. Exercise can get the blood flowing and help you stay warm. But do not exercise to the point of exhaustion. This can exacerbate cold-related emergencies.